There are so many myths and misconceptions when we talk about physical activity and exercise during pregnancy. Probably one of the most prevalent is this idea that you shouldn't be exercising above 140 beats per minute when you're pregnant. This myth actually came about from the 1985 physical activity and exercise during pregnancy guidelines, where they didn't have a lot of research at that point in time about what the maximal heart rate would be during pregnancy. So they decided that they were just going to randomly put 140 beats per minute. This recommendation was actually removed just a couple of years later. They didn't even have a limit on maximal heart rate at that point in time. So this idea that you shouldn't go above 140 beats per minute has actually persisted for the last many decades. And even just last week, I was speaking to an athlete who was told this in her OB appointment. And so we have a lot of work to do to be able to remove this myth, because extensive evidence suggests now that we can go much higher than that. I led the 2019 Canadian Guideline for Physical Activity throughout pregnancy. With this guideline, we put together 12 separate systematic reviews, which were looking at a variety of different health outcomes. One of the key points that we were quite interested in was looking at whether or not being active before or not pregnancy was going to impact your overall health, to try and get at this question that if you weren't active before pregnancy, you shouldn't start during. What we actually found was that those people who were inactive before they were pregnant and started to exercise during pregnancy actually had some of the greatest improvements in their overall health. So there's this long-standing idea that it's normal to pee just a little bit when you're running or jumping while you're pregnant. While it's very common, it actually isn't normal. There's lots that can be done to help reduce the impacts, the symptoms and prevalence of urinary incontinence during pregnancy. So if you are experiencing some leaking when you're running, jumping, or even sneezing, I do recommend going to speak to a pelvic floor specialist to get it treated. So there's a long-standing myth that you shouldn't exercise your core while you're pregnant. More recent research has actually demonstrated that you can safely engage and strengthen your core during pregnancy. This is actually extremely important activity to do while you're pregnant to help maintain your strength into the postpartum period. Most guidelines recommend avoiding heavy lifting or Olympic lifts during pregnancy. Now, this was originally put into most guidelines because there were theoretical concerns that it might not be helpful. We also were drawing from occupational lifting, where if you lift over 100 pounds per day, that it has been associated with adverse effects such as an increased risk of preeclampsia or an early birth. However, it's really important to understand that there's a very distinct difference between lifting for work and lifting in a recreational setting. And so new data is now emerging, which is actually demonstrating that if you did lift heavy weights before you were pregnant and continue during your pregnancy, that you actually have better health outcomes than if you were to stop the activity that you're used to doing in your daily life. Back when we did the 2019 Canadian Guideline for Physical Activity throughout pregnancy, the reason that we recommended a moderate intensity of physical activity is because that is where the vast majority of research studies were based. We actually had, at that point in time, relatively limited information about exercising in the vigorous or near maximal range. If you look at other guidelines around the world, many will recommend avoiding intensities above 80 or even 90% of maximal effort. However, we have emerging evidence which is demonstrating that if you engage in things like HIIT exercise, where there's very short bouts of high intensity exercise, that the fetus actually responds quite well, and we weren't seeing any adverse effects of this short duration of high intensity exercise. What we currently recommend in the Canadian guideline is that if you are engaging in higher intensity exercises during pregnancy, that you want to speak to your healthcare provider just to make sure there's any reasons why you wouldn't want to. So there's lots of questions about what you can and cannot do in the postpartum period. One of the big questions that we get really often is whether or not you can exercise while you're breastfeeding. Breastfeeding is an activity that requires quite a lot of caloric expenditure, equivalent to about burning an extra 500 calories per day. So there's extensive data which demonstrates that you don't have an adverse effect on breastfeeding. Breast milk supply is maintained, the quality of the milk is maintained. The important thing is to make sure that you are well hydrated while you're breastfeeding and maintaining your energy intake to match the demand. There's this persistent belief that if you have a cesarean section, that you will not experience urinary incontinence in the postpartum period. It turns out that this is not actually the case. Because of the changes that occur during pregnancy, the weight of the uterus and the baby on your pelvic floor, you can still experience urinary incontinence during pregnancy, and this can persist into the postpartum period. So if you experience leaking, if you run, jump, or sneeze, I strongly recommend going and speaking to a pelvic floor specialist. It's something that can be treated and improved. The traditional thinking was that after a cesarean section that you should not be active at all until you're cleared at 6 weeks postpartum. But there's emerging data now that's suggesting that early mobilization, so the day of or the day after you have a cesarean section, that it's really important to get up, go for a very gentle walk, and begin to increase your physical activity early on in the postpartum period, even if you do have a cesarean section. Now, there's lots of data out there in other abdominal surgeries that also support this, but it'll be really interesting to see how things move along in the next few years, talking about post-cesarean section physical activity.